the height of the COVID-19 pandemic, many countries imposed tough restrictions to protect their populations from the potentially deadly disease, at times with little regard to the collateral economic and social fallout. In this week's show, we're talking about COVID-19 and human rights. Welcome to our COVID-19 special. In South Africa, unemployment has soared. Jobless and destitute people are everywhere on the streets of Johannesburg. Crime is rampant. Does science offer new prospects for the African country? In Cape Town, scientists succeeded in developing their own mRNA vaccine in just 1 year. But first to China. Since November, protests have broken out against strict lockdowns. DW reporter Han Xuanli explains why.
Down with the Communist Party. Xi Jinping stepped down. This video, which reportedly shows protesters in Shanghai, has been watched over 2 million times online. It's been decades since so many people in China risked repercussions by publicly voicing their anger on the streets and on social media.
I never thought that there would be a day where we could raise our voices like this. You're all so brave. Please protect yourselves. For 3 years, people have suppressed their emotions. Now they've reached their limit.
Protesters mourn the victims of a fire that broke out in Urumqi. They're also demanding a relaxation of COVID restrictions. Many locals suspect that the lockdown measures are the reason the 10 victims couldn't escape.
These are all things that people know from their everyday lives. When there are positive cases in a residential building, barricades are erected, and the building's doors are blocked or locked. But even apart from that, people have come to feel that these policies have gotten out of hand, that they've become irrational, that it's no longer about protecting lives, and to some extent achieves exactly the opposite.
Beijing has been scrambling to contain major outbreaks since the Omicron variant emerged, which led to a seemingly never-ending cycle of lockdowns and mass testing. Public dissent has continued to grow. Despite censorship efforts, some videos are still circulating online, like this one about harsh lockdowns in Shanghai in April. Personal tragedies were shared online, including stories about children being separated from their parents in quarantine. Or this one from a father who says that delays in treatment caused by COVID restrictions led to his child's death.
Aside from the other problems, the lockdowns are of course a massive burden on the economy. China had originally forecast 5.5% GDP growth for this year, but it's not likely to meet that. And these statistics aren't just numbers. There are people behind these statistics. People who run restaurants or work in tourism. And they're all in a terrible economic situation.
Zero COVID is President Xi Jinping's signature policy that he has championed personally. After he secured his historic third term, China did loosen some measures in early November. But Beijing insisted it was not a return to business as usual. China can't afford to drop all measures. That's because Beijing decided to stick with its own less effective COVID vaccines. And vaccination rates in the most vulnerable group are relatively low. Only around 2/3 of people over 60 have had 3 shots.
We estimate that there are about 190 million older people in China with chronic diseases like diabetes or high blood pressure. Those are additional risk factors. China will have to address this problem if they want to avoid an exit wave that would result in extremely high death tolls.
Beijing has now announced a vaccination drive for the elderly, a move that could be the first step towards lifting pandemic controls. China has eased some COVID restrictions following the recent wave of protests. But this isn't a sign that the authorities are completely backing down. On the contrary, Beijing has vowed to crack down on what it calls hostile forces, a warning that dissident voices could pay a high price.
China is not an isolated case. According to a UN report, COVID-19 restriction measures have violated human rights around the world. Uganda also imposed strict lockdowns. DW reporter Julius Mugambwa spoke with victims of police violence there.
Twaha Kabega shows us the scars on his body. He's accused the Kampala police of assault. During the pandemic, security officers enforced lockdowns and restrictions on movement by any means necessary.
I was stopped by 3 police officers riding on motorcycles. They violently dragged me off my motorcycle and started beating me up. I was wounded by a bayonet. I still have a scar. My fingers were beaten, and you can still see what they did to me.
For journalists, reporting on such human rights abuses was also difficult and even dangerous. David Kaliankolo filmed security officers enforcing the nightly curfew in his neighborhood. He says the police later came to his home and assaulted him outside on his veranda, beating him until he lost consciousness.
I suddenly felt a sharp pain in my head before I lost consciousness. I regained it 2 days later at the hospital. Doctors told me that I almost died.
According to the Uganda Human Rights Commission, such abuses rose sharply during the pandemic. Security agencies, including the local defense units or LDU, often acted arbitrarily and without oversight. The Ugandan army says these violations were punished.
The big issue is, if any LDU violated rights of the population, what was done? You saw our courts sat, and they were taken to military courts, and they were charged and sentenced. And some of them up to now are still serving their sentences.
But many victims, including Twaha Kabega, were reluctant to report cases involving the security forces.
I didn't bother to report the case to the police. I just told my parents about it and got treatment for the injuries. As you may know, sometimes people report an incident, but no action is taken.
In his book Quarantined, Ugandan academic and cartoonist Jimmy Spire Sentongo recounts his own ordeal in a Ugandan isolation center at the outset of the pandemic. He insists that the Ugandan state needs to be held accountable for violations of basic rights, even during times of crisis. The cartoons, which depicted injustices and human rights violations during the pandemic, are a powerful indictment of these abuses of power.
If we do not document such experiences, then we don't have reference points maybe in future when we want to make reflection of how to handle them better. It's like everything easily gets forgotten because that was a period as though of darkness where people could freely do whatever they felt they could do when everyone was in panic.
In late September, Uganda declared a new outbreak of Ebola caused by the Sudan strain of the virus, for which no vaccine is available. Once again, lockdowns and quarantines are being imposed to contain a virus. The Ugandan military says it's now working more closely with human rights groups to put basic rights at the forefront of managing the health emergency.
Later on, the president ordered their retraining. They were trained. To date, we have a much finer local defense unit. We have a thinking that if any other challenge comes in, like we are seeing Ebola coming in, all of these agencies will come on board and we are able to work together more harmoniously than before.
On December 2nd, the last known Ebola patient left the hospital, but the lockdown in the 2 high-risk districts was extended another 21 days, the incubation period of the Ebola virus.
Pandemic restrictions were also imposed in South Africa for a long time to prevent the further spread of the COVID-19 virus. The subsequent economic downturn has exacerbated social inequalities there. Many South Africans have lost their jobs and are now doing everything they can to make ends meet.
Electrician Stephen Moyo gets up at 5 every morning and pounds the pavement of Johannesburg in search of work. Even if he finds it, he earns €30 at most. But those good days are now few and far between. The economic impact of the COVID-19 pandemic continues to be felt here, especially in disadvantaged communities.
The situation is worse. Nobody's coming to hire us. And I'm even worried, how can I get money for food and the money to pay the rent since there's no employment, since COVID have gone in South Africa.
The economic decline is catastrophic in the wake of what were some of the strictest lockdowns in the world. An estimated 10 million people are out of work. Many have been left with nothing but the generosity of strangers to rely on.
There's no work and I've given up looking. Now I try to make money by dancing and begging. COVID made things even worse.
Crime, too, is on the rise. Rampant infrastructure theft is putting even more strain on an economy that's expected to grow by just 2.1% in 2022. In Gauteng province, South Africa's economic heartland, railway services have nearly come to a standstill. Thieves and vandals are removing tracks and stripping railway stations bare. In Johannesburg, local authorities are struggling to cope with the rise in cable theft, which has been leaving residents and businesses in the dark.
Because of the number of people who are unemployed and sitting at home with nothing to do, theft and vandalism are increasing. We're trying very hard to keep up, and people are often left without power for hours on end. Teams like this one are working day in and day out, repairing outages caused by cable theft.
Analysts are concerned that the current economic slump could be hard to turn around, and that the COVID pandemic may have tipped the country into a downward spiral.
Yeah, since April 2020, when the lockdowns began and COVID really hit hard with one of the highest mortality rates, we saw the amplification, the acceleration of our contradictions, unemployment soaring 10% to about 45%. You know, you can compare that to early 30s Germany, which was part of the problems that created Nazism, and then austerity. And I fear that the right-wing tendencies, when you have these explosions, rioting and looting and xenophobic attacks, these will get even worse in the coming years.
Large-scale civil unrest already swept through parts of South Africa in 2021. Poverty is also at least in part to blame for the rise in aggression and violence against the estimated 2.9 million immigrants who live in the country. Local vigilante groups have been carrying out checks on shops owned by foreigners.
Yeah, expiry is 2024.
Though they have no legal authority, they've been making unofficial visits to foreign-owned businesses to check for expired goods and for owners' immigration status.
You are here, but you're not allowed to be here, isn't it? So now that is going to be a problem. So who's got your papers?
South Africa is teetering on the edge of a social and economic precipice, and the pandemic is only partly to blame.
South Africa kept extending its lockdown period because there were too few vaccines available in the country. To enable low and middle income countries to produce their own vaccines in the future, the World Health Organization is promoting the transfer of knowledge with an mRNA hub in Cape Town.
How is an mRNA vaccine produced? South African scientists explain the role DNA plays in the process to visitors from an Indian pharmaceutical company.
But how do you mix them?
That you are proud of. Come up with some engineering solution.
That's the exciting part, the changing of perceptions and the building of capacity. South Africa contributes to the knowledge base that exists and training the rest of the world and not just a receiver. This program will allow companies to have the capacity to actually start to produce various vaccines. That means if there's an outbreak next time of a different virus or bacterial, but it's a pandemic nevertheless, the companies will have the capacity to actually respond quickly to that pandemic because they will have in-house capacity to produce vaccines.
The training takes place at the mRNA vaccine hub in Cape Town, run by the company Afrigen. In just 1 year, scientists here developed a candidate mRNA COVID vaccine based on publicly available data on the Moderna vaccine. The World Health Organization is supporting the hub to transfer this expertise to other low and middle income countries.
Before COVID and the post-COVID, things has changed. People are helping each other. They want to help each other to make the society in the better way. That's why we are here. Afrigen is, they have the technology, we have the facility, we have infrastructure. We can make together.
Biological E is a leading vaccine manufacturer in India. It also plans to go into mRNA vaccine production. Scientist Arvind Kumar Jain researched mRNA technology at Oxford University until 2018. Then he gave that up, believing it would be at least 30 years before the technology would be ready. But the pandemic changed all that. Now he's responsible for developing an mRNA platform for his Indian employer.
Once you have the technology in your hand, you know how to handle mRNA. It's very easy to switch from one vaccine to another vaccine. So obviously the first vaccine is going to be costly for you as of learning, as of manufacturing, setting up everything. But once you have it, you have it. You can make vaccine of almost anything you want.
Researchers have already started using mRNA technology to produce TB, Ebola, and cancer vaccines.
This network has the potential to build, to diversify the global vaccine manufacturing landscape. And I think that is the beauty of it. You cannot have pandemic preparedness if you have centralized vaccine manufacturing. We've all said never again. Never again can you find a continent not having access to vaccines because it doesn't have the ability to produce its own vaccine. So we're going to keep the momentum.
Some civil society organizations fear there could be conflicts with Big Pharma, for example, over patent infringement. But not everyone is worried that this could affect vaccine production in South Africa.
We can either license from them or we can invent around it. And that's actually what pharma companies do. Because in any area, generally somebody else is doing something in that area. So they go look at the patents and go and see if they can invent around them. And you know, some of the patents, they're irrelevant because we don't need to use that particular process. So no, I don't think it's going to be an issue.
The biopharmaceutical company Biovac in Cape Town has already made a technology transfer deal with Pfizer. The state-backed company's freezer farm with 130 refrigerators is ready. It could produce up to 100 million doses a year.
I don't think what we have seen in terms of export bans that we've seen in other countries, supply material shortages, I don't think that threat has gone away. It has maybe subsided because the pandemic, and the infectious rate is not that high. But we haven't solved those issues to say what will actually happen next time. Countries haven't come out and said, okay, I did an export ban, but next time I won't. Nobody has actually said that. So the threat is actually really alive. And again, nationalistic interests are likely to take place the next time.
Both Biovac and Afrigen, the major partners of the mRNA hub, are urging their government to maintain support for the industry amid fading global interest in the pandemic.
The US and the Europe manufacturing entities were built on similar structures of subsidizing and support from governments. Low and middle income countries are asking for exactly the same. We ask our leaders to have a long-term strategic view and not a short-term view. So we've done analysis in South Africa. $1 investment in local manufacturing in certain sectors, and of course vaccine would be very high multipliers, effectively can give $13 of economic value back into the country through skills development, stimulating R&D, direct foreign investment.
As the scientists from India wrap up their training, they're optimistic about starting to produce mRNA vaccines back home next year. And in Cape Town, the next scientists from Senegal and Tunisia are ready and waiting.
One African country that seems to have weathered the pandemic relatively well is Nigeria. Dr. Ayi Aibokan has been a practicing physician in the West African country for decades. He became infected with COVID-19 at work. As a medical professional, he closely observed the effects the disease had on his body.
While checking my SpO2, I noticed that there was a daily decrease in the saturation. As at the time it got to about 85% oxygen saturation, I had to call Dr. Kwara in charge of the COVID center, and I told him I'm bringing myself in for admission. And during my stay in the COVID ward, I'm aware of many people that died. I had seen worse cases, although yes, my family was afraid, my wife was, my mother was. The worst times are when I left my bed to have my bath or use the toilet is the dyspnea. What's dyspnea? Breathlessness. And you understand the need for oxygen then, at least the oxygen hunger that was associated with COVID. You would appreciate it more in a patient who tells you, I cannot breathe. As a health worker in a third world country, I believe our government handled COVID well. After about a week there, I improved gradually and I was discharged. I repeated the test, the COVID PCR test on discharge about 2 weeks after the first test, and I was given a clean bill of health. So I went back home and to my daughters and my wife.
Do you have questions about COVID-19? DW Science reporter Derek Williams has answered hundreds of viewer questions. This time, Ketsabout wanted to know, how do the average symptoms from Omicron subvariant infections compare?
When Omicron hit last year, experts everywhere worried about a couple of questions. First was how infectious the new variant would prove to be compared to its forerunner, Delta. And of course, it quickly became clear that Omicron was a lot more infectious. The second question that had everyone holding their breaths was whether Omicron's symptoms would prove more severe than Delta symptoms were. And there was this kind of huge collective sigh of relief when the opposite proved true. Now, there are, of course, plenty of exceptions, but in general, an infection with an Omicron subvariant is less likely to send you to the hospital or intensive care station than one with Delta or earlier versions of the virus. The big reason why, experts think, is because subvariants in the Omicron family, as a rule, are less likely to penetrate deep into your lungs and lead to life-threatening pneumonia. They're more likely to remain in the upper respiratory tract. Some studies have shown that Omicron is a lot less effective at infecting lung cells than Delta and earlier variants of SARS-CoV-2 were. Another oft-cited belief among healthcare authorities is that by this point in the pandemic, widespread previous exposure and/or vaccination are likely ramping up immune defenses much faster when people are freshly infected. And that helps keep their symptoms from spiraling out of control. Researchers so far aren't detecting any major differences in the symptoms caused by different Omicron subvariants. Though they vary from patient to patient, of course, the list often includes having a runny nose, a sore throat, fatigue, headache, and sneezing. So ones that you'd associate more with a bad cold or bronchitis. Doctors are also reporting that patients are much less likely to complain of a loss of smell and taste or of breathlessness, which were frequent symptoms caused by earlier variants.
That's it for today's programme. Next week, among other things, we'll look at how Uganda managed to get the Ebola outbreak under control. Until then, goodbye and take care.